Hi everybody, like Dr. Miller said, I interned with Chinese American Planning Council in New York City. The topic I mostly focused on was aging and wellness in New York City's Chinatown. And my field site is home and housing for elderly. So what is CPC? So CPC is actually a nonprofit that was founded in New York City's Chinatown in 1965. It promotes the social and economic empowerment of Chinese American, immigrant, and low-income communities. It's not exclusive to these three categories, though anyone can really utilize their services. And also one key aspect of this nonprofit organization is focuses a lot on intergenerational care. So they have services from daycare services for two-year-old students to all the way to like 100-year-old seniors. And one of the reasons why I chose CPC was because I was a former participant. My sister, my brothers, my cousin, and I, all of us were part of the CPC daycare and youth programming since we were from 2 to 11 years old. So this was a good opportunity for me to not only give back to my community, but also give back to this nonprofit organization that was very instrumental in the beginning of my life. And also this gave me an opportunity to do more direct service learning opportunity. So I actually interned / volunteered at CBC 2 summers ago, and I was working in more of an administrative capacity. And I wanted to return, but I asked if I could come back as more direct service. I wanted to work more intimately with the population, and they said they had a position for me, so I went back. My site was home and housing for the elderly. It's a 155-unit apartment building for low-income seniors. It's not an assisted living program, so there's no nurses or anyone. There is a management office downstairs, but it's not a nursing facility. It's really just for government-subsidized housing for seniors. I was part of their resident wellness program, which is a fledgling program. They started a year ago. So I was interested to be dropped into this program that there was a lot of freedom because they haven't really figured out the kinks of it yet. And it was when I was interning over the summer, I was part of a 2 to 3 person team. It was my supervisor and me and another intern. One key aspect of this site was that 95% of the housing was Chinese immigrant. So they didn't speak English. They either spoke Taishanese or Cantonese. That was very interesting because I found myself jumping between English, Cantonese, which is my mother tongue, and also Mandarin, which I learned at UR. So I found it really was a challenge for me to constantly balance the different, like translating my thoughts from English to Chinese when I was talking to a senior, and then sometimes translating back from Chinese to English when I was referring to a supervisor or someone who didn't speak Chinese. My responsibility and task, so what did I do? So because this is a fledgling program and we had a very small team, I found myself in a position where I did everything and also or being pulled into stuff. So and this was for the month of July. I taught ESL classes twice a week, and that was interesting when I was trying to teach ESL in Chinese to Chinese immigrants, and that it was a little bit strange at times where I would be trying to explain something, but I had to do a very convoluted way of explaining it because I didn't know the exact words. I also helped bring in health workshops. So I actually taught nutrition workshop and also hoarding workshop, but we also brought in the FDNY, which taught a fire safety workshop, and also this image here was an AIDS workshop that was taught at CPC. I sat in on chair exercises, walking groups. So that was like 7 a.m. every Wednesday. I would walk with the seniors in New York, and I also helped with arts and craft activities. These are just the scheduled activities. Outside of this, I did general casework, such as helping them call government offices, cable company, their phone bills, and like even just filling out forms. I did door-to-door outreach, so I would knock on each person's door and advertise events or just let them know there was something going on. There was one interesting case where I had to announce to everybody that there was no water. Sometimes I would walk into an apartment and I see them already filling a tub full of water because they were like, oh, I already heard. And I tried to explain that they didn't need to fill up a tub full of water, but they did it anyways. And I also helped with special events such as birthday parties or any like partnership events that they brought in from outside. So one event I wanted to highlight was the Spectrum Safe and Healthy Home Kit distribution. It was a partnership between CPC and Spectrum, which is a TV internet cable provider in New York City. And we were giving out these emergency home kits, so inside there were like smoke detectors and Band-Aids and like Clorox for seniors to use in case they couldn't get out of their apartment and there was an emergency situation. It was 1 box per apartment, and within the first hour, we gave out 120 boxes, keeping in mind there's 155 apartments in general. So that picture on the right is only a snapshot of how many people were in the lobby. At the peak, there was about 300 people in the lobby, and we actually got in trouble because it was a fire hazard. Part of this is actually part of the Hongming Emergency Preparedness Initiative, because 2 years ago there was a fire at a synagogue right next door. Hongming is a fireproof building, but it raised concern of how do you evacuate all these 300 seniors in the case of either hurricane, because we did have Hurricane Sandy, and also in the case of another fire that might potentially leak onto Hongming. And so I was also part of the mobility registry collection team. So I went to each store and I would talk to each senior and ask, do you use a wheelchair? Do you use a walker? Do you use, can you walk on your own? Or do you use a cane? And it was interesting because seniors don't always want to disclose that they use a mobility device, and they want to say that I'm fine, I can walk. But then when we ask, if you can you walk down 14 flights of stairs? They're just like, no, I cannot. So this mobility registry is also really important because we want to make sure first responder knows which apartments they have to hit first in cases of emergencies. Oh, I didn't finish. One thing I wanted to also add that this experience really highlighted the tension between desire to implement a program and the implementation of a program. As I mentioned, we had a lot of people come to the event, and we didn't necessarily know how to organize the event because there were so many people. Everyone spoke different dialects. Everyone had working at different time schedules. Some of the home attendants were pushing each other because they're saying, we get off at 2 p.m., we have to leave. And I'm just like, can you get back in line, please? But they didn't want to. And I think it really showed that even though CPC wants to implement this wellness program at Hongming, there's not enough manpower to actually do it because not all of us, all the people that show up that day to help run this event, not all of us spoke Chinese, so it was very difficult for some of my other co-workers to communicate with this population because they didn't understand what was going on. Theories versus practice. So as part of the academic component for this fellowship, my faculty advisor, Dr. Jennifer Norse, gave me a lot of literature to read. I read a lot on Chinese aging and elderly care and Chinese immigrant communities in different parts of the world. But I chose this one because I think it fit better with the speed and the shortness of this presentation. So I chose Nina Chappell and Karen Cush's The Gendered Nature of Filial Piety, a study among Chinese Canadians, because they introduced this concept of Asian care model versus the networked families or intimacy at a distant model. And I chose this because I come from what they would call the Asian care model. And my family was actually considered disrespectful to put your grandparents or your parents in a senior home. And it was considered seen as shirking your filial piety responsibilities. My grandmother actually lives with us, so it was very interesting to see how she felt about Hongming when I was talking to her about this over the summer. And so a lot of Hongming seniors live in this networked family model. Their families usually don't live with them, or if they did live with them, they didn't always were there available. They were either in New York, or sometimes were either in New York, New Jersey. There were some incidents where they were still in China or in Colorado, so there's this very big network. And I didn't realize that coming from an Asian care model would actually frame how my initial reactions to this field site. I thought that, oh, they must be lonely, they might be estranged from their family, they might not be very happy there because they weren't living with their family members. However, I was proven to be very wrong by the end of this. I realized that it's not necessarily a bad thing, and in fact, not all, but some of the seniors enjoyed the independence they got. They were happy they could go wherever they wanted, they could come back whenever they wanted. Their kids actually visited pretty frequently or called them pretty frequently. Some of the seniors would just walk, take a subway and go see their children. So they didn't have this experience of being estranged from their families or feeling a sense of loneliness because their families didn't live with them. I think the main reason why I thought they were lonely is because they would sit in the dark a lot in the middle of the day. But it wasn't because they were sad or anything, it was because it was more economical to sit with the lights off and use daylight to save money. Also, I realized they also build new communities and families or fictive kin within this housing with their neighbors and even their home attendants. So one example was that we were asking this senior to give us an emergency contact information, and she said, well, just put blank. She lives on the 6th floor, and she's my emergency contact number. And my supervisor was like, you can't do that. She's not a family member. And then she said, no, but it's fine because I don't have family here. She's the only one. If anything happens to me, I know she wouldn't know what to do. So this is an example of how they built their own communities communities develop their own like new families within this housing, rather than just relying solely on their biological family members. So what did I learn? After this internship, I learned that elderly care is very different for every seniors, and I should not make any assumptions about people's families or people's like personal experience with it. And often I found myself really wrong, and it didn't lead to any conflict, thankfully, at the field site, but there were times when I found myself very surprised. It also gave me more awareness and sensitivity regarding this specific population. I thought because I was Chinese American, I would not be surprised by anything, like, oh, I know I know what I'm going to be expecting going in. However, I realized this is not necessarily true, and that these seniors actually taught me a lot about like being independent and being away from your own families than I thought. And a lot of them were actually in better health than I was, which is surprising. But these are 80 and 100-year-olds, and they were like in much better health. And I was like, teach me your ways. And I just had so many experiences overall. It was very overwhelming at times. And self-care was something I had to learn along the way, because I work from 9 to 5 every day for 40 hours a week, so I had to learn how to take care of myself emotionally and how to walk away after work and be able to kind of like decompress and not go back to the field site the next day being very grumpy. But there were days when I went and I looked very like upset or very sad, and the seniors would notice and they would give me fruit and they would be like, oh, feel better? Are you sick? Is something wrong? And I'm like, no, this is a new experience. It also informed my future plans. I do want to continue to go to grad school. I'm looking at programs to do either social work or working in community health, and this is something I realize I'm really passionate about and I want to continue working on moving forward.